Hello, and welcome to another in the series of clinical uses for the BVT instrument. My name is Charles Shear. I'm a neurooptometrist for Burtech Corporation. With this video, we'll discuss how to use the BVT to evaluate and treat visual neglect and visual field loss. Head trauma and stroke can often cause a hemianoptic or hemispherical field loss or visual neglect and create significant challenges to our patients. True visual field loss is the result of damage to the neural pathways between the eyes and the visual cortex. This type of field loss is often a complete loss of vision to one side. Fortunately, it usually spares the macular region, so they may still have 20/20 acuity. When stroke or trauma causes damage to the visual pathways, the nerve fibers that leave the eye cannot conduct the electrical signals to the visual cortex. With visual neglect, these pathways are intact, but they're just being ignored. When looking at a picture of a clock and drawing it, the patient with visual neglect will draw it like you see on the lower right. The patient with visual field loss will see the whole clock by moving their eye from side to side and draw it normally. Regardless of the cause, there are several therapeutic strategies that may help these individuals. In the rhythm mode, the BVT will alternately present targets to the right of center and then to the left and back to the right. When presented in this way, the patients know to look to the side to find the target, requiring them to scan, search, and develop compensation skills. There are several ways that this may be accomplished depending on the needs of the individual patient. The technique chosen basically depends on whether you want them to cross the midline with their hands to stimulate alternate hemispheres of the brain each time. We created a short animation to kind of demonstrate this. In the first example, they'll touch the target on the right side with the right hand and the left target with the left hand. We call that uncrossed. In the next example, we'll use the cross technique, or they have to cross the midline. So they're going to touch the left target with the right hand and the right target with the left hand. Variations may be added to this. If you have a stroke patient who has a lot of difficulty with motor movements of one hand, you can have him just use that. And one time he'll cross and the next time not cross the midline. You need to know your patients, of course, and a lot of times we start with one but end up with a midline cross because that is the most difficult of the techniques. So let's choose the rhythm mode on the BVT instrument and set it up to do this with the first patient. We're going to start with a plain background, the largest targets that we can. And what we'll do basically is have the patient crossing the midline in this case. So we'll use a green target, the extra large scale, extra large sensitivity, because we're not worried so much about accuracy. We just want them to pick up the target. We'll set the duration to 15 seconds in this example here, but you probably would do a 30-second trial with most patients. You want to be sure to have it on self-pacing as well. When they have a plain or static background, the emphasis is on improving scanning and saccadic eye movements. This is sometimes referred to as top-down types of therapies. We can make it more difficult, the search pattern and the scan more difficult, by just selecting a different static background. Here, of course, the green dot may tend to get lost in some of the peripheral stimulus on the sides there. But again, they have to search, and we're trying to move them towards real-world techniques. The addition of OKN stripes to the background draws the eyes and the attention to the side that is lost. The directions of the stripes, or the slow phase, should be towards the size of loss, in this case to the left hemisphere. If high contrast stripes cause too much discomfort, the contrast can be reduced, but this also lowers the therapeutic effect. So you want as much contrast as you can to get the eyes to track over there the best they can. You can also reverse the direction. This will cause the eyes to pursue away from the neglect side or loss, but it forces the eyes to make a saccade back to the loss side, and sometimes this is effective too. There's an argument that to be made that it is good to do both directions, but the more accepted way is to have the slow phase move towards the side of neglect. When they get good with the vertical stripes, the next progression would be to move to the optic flow circles. This tends to expand the awareness from the center out. And in this case, we're trying to expand it from the center to the left side. This is best accomplished by starting with a slower speed and a higher contrast target if possible. And then, of course, you make it more difficult. The ultimate goal is to be able to move to real world situations and improve their confidence and mobility and reduce their risk of fall. I'd be remiss if I didn't also show you an additional method that accomplishes a similar therapy with a little less emphasis on the midline and a little more customizable. For this, we'll go to the peripheral mode and use its focus zone. Here we can select a large zone with either a 50 or 75% saturation of the targets into that zone. We can also set that to the left, right, up, down, wherever we want. In this case, we'll move it to the left. So what you're going to see is 50 to 70% of the targets are going to fall within that circle. So obviously we want to put that to the side where the neglect or lost is. And we can move the circle and change the side and put it anywhere we want on the screen. Likewise, we can add the OKN stripes or any of the other backgrounds as we showed you before. And this proves to be a very effective technique. The key points that we want you to remember from this video is that there is a difference between visual field loss and visual neglect. And in spite of these differences, the symptoms and therapies are very similar. The BVT is an ideal instrument for the treatment of these problems through its unique ability to change the target presentation and the video backgrounds. I want to thank you for watching the video again, and we'll be bringing you more videos similar to this, and we hope you enjoy them. Stay safe. Thank you.